It's our responsibility in doing this study to give families as much information as we know at this time.
Informed consent is the process by which the patient learns about the trial, understands the risks and benefits, and gives her consent to be part of the randomized study.
True informed consent really takes place over a period of time.
Leading them through the day-to-day events of evaluation
so that they can make the most informed decision possible.
The initial contact by either the interested family, being the woman, or the woman's perinatologist or physician geneticist is made through George Washington University.
We're the central place for the patients to call when they first hear about the trial.
It's the job of the coordinating center to guide the families through what is involved in the study and how they may or may not be able to participate.
A great deal of work went into the design of the trial, and in particular, the inclusion and exclusion criteria for the trial.
The inclusion criteria are meant to define the population that you're studying, and the exclusion criteria define certain conditions that would make the study not safe or unlikely to be beneficial. In this case, the inclusion criteria, of course, the fetus has to have a myelin meningocele. There has to be evidence of the Arnold-Chiari malformation. The mother can't be too far along in pregnancy. She has to be between 19 and 25 weeks by the time of the surgery. And the lesion has to be between the T1 level and the S1 level on the spine. Exclusion criteria mainly revolve around safety.
For instance, an exclusion criteria in this trial is a woman who suffers from morbid obesity, because we know that women who are morbidly obese are at risk for surgery. So we did not want to do a therapy where there was the unknown risks and benefits to a woman who has an additional risk for surgery.
Early referral is important because there are a lot of things to sort out before you can take part in the trial.
When a family is deemed eligible to participate in the study and they travel to one of the 3 centers, it really becomes the center's job then to continue the education that was done at George Washington University.
It gives them the opportunity to ask a lot of questions, not only about the diagnosis, but also get their questions answered about what their responsibilities and commitment would be if they chose to participate in this study.
They undergo 2 days of screening. One is interviewing, education, and testing with an ultrasound, a fetal echocardiogram, and an ultrafast MRI. And then they undergo another day of testing to determine the ethics of participating in a study, the ethics of randomization. How do they feel about being a study subject?
Then the family also undergoes a series of meetings with the professionals and the team at each site that's involved in the mother and the infant's care.
Neurosurgeons, social workers, perinatologists, fetal surgeons, neonatologists, study coordinators, just a whole host of folks that are there to help the family both medically and emotionally.